and about 1 in 12 Canadian adults itself at the age of 20 and plus are diagnosed with heart disease. Does that mean that, it's something that we accept? Is it just genetics? Is it something that we can play a role in as well? It doesn't mean that, if my mother has heart disease, that I'm going to end up exactly the same, correct?
So there is definitely a genetic component to it. There's no doubt
Yep.
about it, right? But having said that, though, there is also a large environmental component. So whatever genetic component you have, it does not mean it's doom and gloom for you. So that means is that you can actually delay or minimize the time of onset and the severity as well, right? You think about not just the time of onset, but also the severity. So if you had a heart attack, it may not be as bad if you're a healthier individual. There's a lot of things that we have in our power that we can modify whatever genetics we have to as well. So that's very important.
The stats are out there that it only takes about for cardiovascular disease itself, 10 to 15% of body loss to actually have an improved outlook of overall health on the cardiovascular element. It's not that you have to have half your body weight gone. It's starting to improve early in those stages as we get going. So, even on early stages within, the first 6 months, we can have individuals. Well, really, it starts on day one, improving that element, the mind and the actions as it goes. But, when it comes down to fatty liver disease, it's really only taking around that 5 to 10% of body mass loss to get those improvements as it's going along. Hypertension is just within the first 5%. We have a lot of individuals that, come along with the hypertensive elements. Hypertension then does put strain on the heart itself. So, you're cutting out that one of those first little key elements to help you along that journey as you go. So I want to talk a little bit about reducing the risk of heart disease and what that could actually look like.
And that's the concept that people don't understand is why or how we develop coronary disease. And so what the current theory is now this might change obviously as science becomes better, and is that we used to think like coronary disease is a clogged artery, right? It's like you take a pipe and it's clogged at home, your sink, and it's clogged with like gunk, right? And so you just gotta push it away. But that's not true. What happens is that there's micro cracks in the inner lining, the endothelium, the inner lining of your coronary artery disease. And basically what that does is that crack causes a cascade, and the body tries to heal itself. So it's really an exaggerated healing process. So you get these platelets, all these factors come in, and they attract, and they make a little mound where the crack is. And over time, what happens is that these kind of plaques get hardened, they become sclerotic, right? And then they can break off. And so that's why we get the narrowing, right? And so that's why when we, in our clinic, when we do our initial blood work as an assessment, we look for inflammatory markers too as well, right? And the goal is to reduce inflammatory markers. So where do these inflammatory markers come from? Lifestyle, meaning like stress and stuff like that. That's why we say stress, is one of the things you have to do to reduce in order to reduce your risk of cardiovascular disease. But also the food we eat, the processed food, the non-refined, so the super refined food increases risk of inflammation too as well.
Yeah, and those processed foods are, unhealthy trans fats, your sodiums, the added sugars, all those things that pull into it, more metabolic issues that can occur along the way, diabetes and
how much do you think environmental plays a role in type 2 diabetes versus genetics, right? This is the same thing for a lot of chronic diseases or lifestyle diseases, right? Is that you live in a household with your parents and siblings as well. And so you tend to eat the same types of foods. You go out to eat together. If mom makes the food or dad makes the food, it's what you eat. And so you develop kind of your behavior as a child and your emotions that related to the food, because emotion is a big component of what we see as well. And so we try to overcome that. That's very important. And so that's why, to a good degree, I think that, it seems to run in families quite a lot, aside from the genetic stuff like that, right? Because, we we learn our behaviors very young, and our conditioning, environmental conditioning, very young.
Nurture and
And so you,
nature all together.
yeah, and then nature versus nurture, and so you can learn to condition new behaviors and uncondition as well, right?
Yeah, the unconditioning is the journey, right? These elements of how do we reduce these risk effects are things that we actually have control over, when it comes down to those adjustments. Regular exercise is very important. When we think about our heart, it is a muscle. It does need to be trained and practiced and worked with as well, to keep healthy as it goes. So aiming for at least 150 minutes of moderate and intensified exercise, or the 75 minutes of vigorous intensive exercise per week.
The therapeutics are better. We
Yeah.
have a lot of good medication out there. We're recognizing the risk factors of cardiovascular disease, and we're tackling, for example, like treating insulin resistance before you get full-blown diabetes, treating pre-hypertension, treating your weight earlier. People think yo-yo dieting is a bad thing. It's just not. It's not a bad thing. It's just something that happens, in the sense that there's a physiological response to the body when you lose weight, right? The body wants to go back to its highest weight. So if you're let's say 350 pounds and you want to lose 100 pounds and you're successful, so the body's going to bring you back up. It's called weight memory, right? And it's a physiological response, and as you lose more and more weight, there's an adaptation process that goes on. But having said that, though, right, the people that try 3 to 4 times and they lose weight and they're successful losing, 10, 15, 20 pounds and stuff like that, you don't really gain all the way back right away, right? There's a lot of benefits with just some weight loss. And the fact that they've actually lost some weight, they actually fare better than people who actually don't try to lose weight at all and stay the same weight. So there's the data that shows that. So those that yo-yo diet or have weights that fluctuate up and down because of dieting, or or weight loss attempts, I should say, weight loss attempts, fare better from a cardiovascular disease perspective.